Hello, everyone. Welcome to the Infection Control Exchange podcast. My name is Wayne Tucker, the host for the podcast. And in this episode, we're going to be talking about doing part 3 of the construction series. So there was a fair bit to talk about. So I felt that it actually needed 4 parts. So I'm going to do another episode after this one because there is a lot to construction when it comes to infection prevention and control. And to give it justice, I felt that it needed one more episode. So it'll be a 4-part series instead of the intended 3 parts. So let's get into it. So, I think when we get into talking to actually starting the construction part, we're making that shift away from like a theoretical perspective, I guess, to like a uh, real time perspective of construction occurring. So what was, I guess, just once lines on a drawing. Now you're dealing with construction generated dust and debris. The airflow can be disrupted as well, and you got people moving through, like, it could be active patient care environments, because it could be let's take it from a perspective of a major renovation to an existing healthcare structure. So in this episode, we're going to focus on, what actually happens during the construction, and, why it introduces some of the highest risks that need to be tightly controlled. So from my experience, my perspective, I've been part of construction and infection control for a number of healthcare projects, including primary care, be one that I've been part of, public health, be another one, and with an acute care environment as well. Been part of them on a number of capital projects. So a fair bit of experience dealing with construction and infection prevention and control. So like I said, there's a fair bit to get into. So we'll kind of talk about some of the risks. So for example, for construction, you look at, you know, it is an high risk phase. During construction, many things can occur. That's why usually these type of projects, there's someone assigned, an infection control practitioner or lead for the construction project, because the risks are quite high. For example, let's say it was an acute care environment for the patient. So someone will be assigned to ensure that everything that's being going according to plan for infection prevention control perspective, and that there's a plan in place to protect the residents as well as staff. So, but there's many things that can go wrong. Like, you have to be putting up those protective barriers. For like this example, right? Major construction projects, so you got to be putting up those protective barriers from floor to ceiling. Make sure that everything is tightly sealed, and there's no dust gonna come out from the construction location where the renovation is occurring. So you gotta, take a look at those protective barriers, make sure there's no those gaps in it. Make sure that if it's an entrance area and if there's a zipper that you have to go up, or a door that you need to open, make sure that's got a good seal into the center into the construction site. There's many things you got to look at. Uh, so another one would be like just the airflow patterns can get altered. So you gotta, these are things that you gotta take a look at. You don't want any of that construction to debris to come back into the healthcare setting. So it's going to be set up so it's got negative pressure, and all that um, debris and stuff, dust is going out outside and out of the healthcare setting and not coming back into the healthcare setting via positive pressure. So you need to have that negative pressure in place. Same as you would have set up for a isolation room, negative pressure. And the difference, I'm sure a lot of people know, but like for an OR, for example, you don't want anything coming into an OR environment. So that's set up for positive pressure so that when that door is open, the airflow is going out of that room from the OR so that nothing's coming in. So you got to be looking at all that airflow patterns and make sure that it's negative pressure within that construction area, and there's that debris, that dust is going out of the construction area and not coming back into the the currently used section of the healthcare setting. So, the traffic patterns is another thing that can get changed. Number of things got to be set up depending on that debris is going to be transported out of the construction area, and that can vary um, if it's coming out into the patient care environment. Let's say that's the only way, and there's maybe they're using a service elevator to remove that construction debris. Then it's it's got to be make sure that that debris is coming out in containers that are got some type of covering or like some kind of protective barrier, so it's not going to get distributed into the patient area. So you got to make sure that it's being transported correctly and out of the care setting, and that it's being disposed of and taken off site in a proper way. But you got to make sure that the debris is leaving the facility in an appropriate manner, and nothing's going to get spread to the patient areas. So yeah, so you got to be careful with those traffic patterns and stuff for large healthcare setting. There could be a lot of staff or construction workers coming in and stuff. So you need to make sure that you're getting appropriate training from an IPAC perspective, and you're spending some time with the general contractor or the contractor you have for the construction project and stuff. So many things that you got to be keeping them informed about, and doing the education as well. So, we've already talked about a little bit about that dust generation and that negative pressure within the construction environment. So that's where the risks are coming. One of the risks is there's risk contained within that dust, and the aerolization of those fungal spores. So you gotta be careful with those. That there's no negative pressure failures occurring within the construction project, and it's got enough air exchanges as well. You gotta be careful about the air exchanges. And you gotta be doing kind of like same as you would do in any kind of setting, like as you're doing your rounds, it would be the same thing. So you have to do your rounds from an infection prevention and control perspective when it comes to that construction project. So you'll be going within that environment, with wearing all your appropriate PPE for a construction project, and then making sure that everything from an infection prevention and control perspective is being taken care of. So you got to be doing your rounds, talking to the site supervisor and everything. So you can be doing that kind of like on daily, and then answering a lot of questions as well that might come up for an infection prevention and control perspective. So it is a different type of work. I guess that's why you do see sometimes IPAC leads and managers or directors involved with it, because it's there's a lot to be taken care of, and you need to make sure that you got appropriate training to do the construction piece, I guess, from a IPAC perspective. So it's a fair bit to get into talk about. But the other thing I wanted to talk about is what are some of the infectious diseases that are, most at risk during construction? So, these are real pathogens that, we're talking about that consistently show up when those IPAC measures are not being followed by um, those doing the construction project. So one of the I think it's not that any of these are going to be too surprising to too many people, but one of the highest risk organisms during construction is aspergillus. So you know that can occur, when there's a disturbance with the dust, part of a construction project, especially when it's part of a construction project that could be like an extension and connecting to an older section of a healthcare setting. So those spores can get into air, and if you don't have uh, if there's gaps in the barriers that have been put up, or your pressure controls fail, and you don't have that negative pressure, you have positive pressure with that airflow coming back into your healthcare setting, and you have a risk for spreading uh, aspergillus into the operating or the section of the healthcare setting that's currently being used. So, and then the spores can get into the patient care areas, and this is especially dangerous for compromised patients. So anybody um, in the setting for like patients in the setting for like oncology, transplants, ICU, NICU, all those settings. I just provide a few examples that would be very dangerous for those patients. So another one is Legionella. Is another major concern during a construction project, particularly during and also after the construction project. So what can occur is like water shutdowns, stagnation of the water, and changes in plumbing create those ideal conditions for growth for Legionella. So, and that risk can be there for a while. It doesn't disappear, uh, immediately. So it can be there for weeks after occupancy, which is one reason why sometimes it gets missed as well. So another one is, for example, yeah, so Legionella, be careful of that. Another one is non-tuberculosis mycobacteria. So, and which can really thrive in like plumbing biofilms and can become aerosols through sinks and showers. So, um, so that's the risk there within the plumbing biofilms, especially when you're tapping in, for the extension or the construction to existing plumbing and stuff. Um, and as well as when you're setting up, the water, the plumbing and everything for the new location as well. So you could have risks associated with that. So there's also risks associated like with the spread of some of those common multi-drug resistant organisms like MRSA and VRE. Um, and that's not because they're not created by construction, but because the dust and the debris uh, just disrupt workflows and increase environmental contamination. So, and movement between clean and dirty areas. So, you be really careful with that. So MRSA and VRE, just a couple examples, can spread during the construction. Um, so there's a couple more examples. So, in terms of the risk, um, and that's, I think the key thing to point out is that, it's not that, um, it's not that construction is, introducing new pathogens into the healthcare setting. It's just circulating or mobilizing the ones that are already present within the healthcare setting. With especially within the the currently part of the setting that's currently operational, and you're tapping into those those systems. For example, the water system, for example, is one of the stuff. So there's risks associated with all that, and that dust, it can be aerial size. So in the environment, so that it could be could be a healthcare setting that's been there for 30 or 40 years. So, and that can make dust can get in the spread to the system, the airflow system. So we gotta be really careful about that. We've always talked about so important to take a really close look at those um, improperly sealed barriers that are protect barriers that put up for construction projects, um, and make sure that that they're sealed tight, as I just mentioned earlier in this episode, that there's no gaps in it for airflow through all. So you got to examine it closely and make sure that there's no issues with any dust coming back into the healthcare setting. I'm talking about the negative pressure. You want to make sure that. So you got to be testing, taking a look at and examining um, all those barriers to make sure there's no gaps within it, right? So if there's gaps, then you need to get those fixes as quick as possible, because that's a serious issue. And you'll work with the the site supervisor to get those resolved as soon as possible. So, as well as make sure the anterooms are maintained within the construction project as well. You're gonna be This way. It's far from a simplified process for IPAC and construction. So you got to get familiar with many different things. Another one would be the HEPA filtration. Make sure that you got adequate HEPA filtration within the construction project, so everything is getting sent to the outside the healthcare setting. So, and make sure that there's enough air exchanges per hour, so that all figured out for that negative pressure within that construction site. So yeah, it's within the training that you'll do with the construction workers, is part of it is which patient groups are at most at risk because of the construction. So you're going to be providing the training to the construction staff that has to be built in, working with the site supervisor. So you're going to be doing construction worker training for infection control. Make sure that they're quite aware of the risk and the importance of following all of the IPAC measures. So in the previous episodes for the series, I already talked about the importance of doing that infection control risk assessment. So I'm not going to go too much in details in this one, but here the IPAC measures that'll be set up and put in place. They're determined using that matrix. Determining what size of a construction project is this? Like, is this just some small changes, or is it a major construction project? So you get a matrix that's created based on the type of work that's being done and the populations of residents that are at risk. So, in using that ICRA, you determine where in that matrix, and then that matrix will be set up with what when you merging those two within the matrix. That's gonna you'll have it set up so that will tell you what IPAC measures that need to be put in place for that type of work that's being completed. So, but I won't go into too much more detail than that for now. So other things is to, what is I kind of talked about a little bit, but in terms of your role as a, an infection prevention control professional assigned a construction project, and you more likely assigned a variety of construction projects, but uh, you're going to be there to play a very much an active role in problem solving of many issues on a day-to-day basis. So you're not there as an advisor during a construction. You're there as an active participant to ensure that the IPAC measures are being followed to protect the residents and the staff of your healthcare setting or settings. So it's the same, well, different, but I already talked about the importance of the design. I'm not going to go into that again because I talked about that a fair bit in the parts 1 and 2. But in this part, we're talking about we're moving beyond the design stage of it to where the construction is now an active construction site. We're not no longer looking at plans and altering those plans from an infection control perspective. You're now an active participant of that construction project, and ensuring all those IPAC measures are being followed. And you got to be same as you would be doing your rounds and everything that I've talked about earlier within this part 3. Within doing your rounds that you would do as part of a normal IPAC role, you're doing that within the construction project. So you're looking to make sure that everything is being followed, that you've put in place based on the scope of that project and the populations of in this case, I'm using an example for acute care hospital that are patients that are at risk. So, and then that ICRA will tell you what you need to put in place, right? So I won't go too much detail about that, but there's there's a fair bit to go through and kind of take a look at all those risks that are there to make sure that they're being taken care of. So as you're going through that, you're going to be having those meetings, meeting with the site supervisor, you know what you'll be at a number of different meetings. They're going to be at meetings with the construction team and everything, and you got to make sure that you're an active voice there at those meetings and tabling any issues that you need to bring up. So you got to make sure that your issues are being tabled and that it's getting the appropriate attention that it needs, and not just being a last minute thing. Left 2 minutes of the meeting, we're going to talk about IPAC. You can't allow that to occur. You got to make sure that it's given adequate time to protect the residents, and you got to be explaining at those meetings, as well as during inspections, verification of that negative pressure within that construction site, the integrity of those barriers that I've talked about, and any escalation of those risks that you're seeing on site. So this for the construction part, it's this is where there's those pathogens that I've reviewed a few of them. I just provide some examples that they're at risk of getting spread within the healthcare setting that's under construction. So during construction, you have the that risk of those pathogens being released, but you can reduce that risk considerably not going to say you're going to be able to reduce it to zero. That's not possible, but there's many things you can do to control it. And you need to be sure that you're putting all those measures in place and taking care of those. So, um, and we'll move on to a different segment right now. So I want to get into talking about the anterooms during construction. So I just talked about it just a little bit, but I felt that we need to spend a little bit more time talking about it in terms of airflow and when there's negative pressure or failures within the construction project. So it's important to kind of go through that in a little bit more detail. Um, what is think about it like what is the whole purpose of the anti-broom within the construction area is to maintain that negative pressure. So I've already talked about why we need to have that negative pressure. Is that we don't want anything coming back into the patient area from the construction area. We want to go in the other way, the construction area to the exterior of the construction project or the healthcare setting. So the whole purpose of those anti-brooms is to help maintain that negative pressure within that construction project. So and as I said, so the airflow is going into the construction zone, going in. So as you're entering the construction period, nothing's coming back out. So that's extremely important. So and even when it's set up, uh, things can go wrong with it. So those machines can be like turned off for a few hours, and obviously if they're turned off, they're not doing what it's supposed to be doing. The pressure needs to be checked daily, or I should say uh, the HEPA units are not are not being checked to make sure it's maintaining the pressure. So that can create a problem. Obviously, make sure it's got enough air exchanges per hour. Another thing that could go wrong in terms of with the anti-room, in terms when it comes to maintaining that pressure, is as I've kind of alluded to before, there's gaps on the door or poor seals around it, or temporary wall leaks or cuts in it, so that the negative pressure is not being maintained properly. So, um, and what can occur with is with those gaps, those protective barriers for the construction project, is that dust and fungal spores like aspergillus uh, can can escape into the patient care areas, and the risk to the patients depends on what type of patient zone it's entering into. So very important to make sure uh, that there's no risk for negative pressure being maintained within that anti-room area. So um, so it's so important to take that into consideration. And it's one of the things also want to talk about um, where things kind of between IPAC and construction commonly break down. So um, so I want to talk about where things break down. Um, and not everybody's got good intentions. So we kind of gotta pay attention to looking at construction. Uh, some of the construction timelines could be changing, um, and that the dust barriers that I've talked about could be removed temporarily for whatever reasons. And I've already mentioned with the anti-rooms that the negative uh, air shut off after hours. So you have to once the construction where workers leave the site. So that's some of the things that can go wrong. Breakdown in, um, you know, for the IPAC measures. Say they can't, if these things happen, then the, IPAC measures are not being followed. So, another thing that can go wrong is the IPAC is not being informed. It's being informed after the change, not before, right? So there could be things occurring that you need to be aware of, and give your opinion, your voice on, and make sure, um, on some of the things that they're proposing. So they just can't go ahead and just do it, but they need to be running those things past you, to make sure it's okay from the infection prevention and control perspective. So, um, and then, sometimes the risks, IPAC risks, are introduced, very quietly, like ceiling tiles being lifted, for example, within the zone. Um, corridors, uh, shortcuts for trade. So they could be, not, not using the designated path for the construction and removal of debris, for example. So, they realize there's shortcuts, and they start taking those shortcuts rather than the designated path for the construction staff, for the project, right? So they figure out there's a little shortcut, and they're not using the designated path that's been outlined and explained to them by the IPAC lead that's responsible for that project. So you can always often see uh, that gap between the the policy or the plans that you put in place for that project and what actually is happening in practice. So the policy might say do daily inspections, um, whereas what you might be seeing is, um, those inspections occurring when someone remembers, and that's not enough, um, to be in place where someone just remembers. It's got to be following what's been decided on and what is the best practice for that construction project. So you got to make sure that's being, that there's no gap there between what you've outlined in your plan for infection prevention control and what's actually occurring. So and you pick up on those things with your uh, daily rounds for the construction projects that you're responsible for. So, and that's those things that you're looking for, the difference between that policy and the practice. You're looking for those gaps. You're looking for people taking shortcuts, um, avoiding the designated path. So these are all different things you're looking at. Um, so you want to make sure that, like a lot of the construction related risks, infection risks, don't happen because people are ignoring infection prevention and control. They're happening because IPAC isn't sometimes looped in at the right time. So you got to make sure that you're part of that process uh, throughout the construction project, and that you are being looped into the right meetings. I mean, that you're talking to the right people during the construction project, so that so you can lower those uh, infection control risks for the populations that you're responsible for the patient population. So that's why it's so important. It is a big responsibility, because you do not want to spread any infectious disease within that patient area that's healthcare part of the setting that's attached to the construction component itself. Very important to do everything you can to reduce that risk. So, um, another thing is, um, your actual role during that active construction. So, uh, it's sometimes it's, your role is not during active construction, isn't to slow projects down. Like that's not your uh, intention to slow it down. Um, but that can occur because you're trying to protect the patients and the staff, and you know, that in order to do that, you got to make sure certain things put in place. And depending how, the contractor and the site supervisor, you need to be taking all the IPAC measures seriously, and not taking it that you're intentionally trying to slow down the project. Nobody, in IPAC is trying to intentionally slow down the project. They want to get the new project created as much as anyone on the leadership team, but they're not gonna allow that construction of project to put anybody at risk of getting an infection due to way things were, say, mismanaged through the construction process. So yes, it can result in delays in the construction project, but they're not done for the right reasons to protect those vulnerable, whether it's residents or patients of a healthcare setting, is to make sure that they're being protected. But like I said, it can certainly result in delays. But if you're having problems, then you need to be meeting with the construction team and resolving those IPAC measures as quick as possible so that it doesn't result in those delays. But they won't. They'll be very temporarily, and everything will be up and running, very quickly within hours or even quicker. But you don't want to be resulting in delays or weeks for IPAC, because once those things are brought up, those issues, then you need the contractor, the site supervisor needs to be dealing with them and taking care of them, and then the project will resume. So you get those things are going to occur. So um, and then during an active project, the thing you're going to be doing is taking a very proactive approach, and I've already as opposed to a reactive approach. You're not going to wait you know for those problems to occur, like I just talked about. In terms of delaying a project, you're going to be doing, as I talked about earlier in this episode, different segments. You're going to be doing the work so that you can proactively find potential issues. So you don't want them to become big problems or big issue, because then it's going to be harder for you to resolve them, and it's going to take potentially longer to resolve them. So by being proactive and doing your rounds, to do your walkthroughs within the facility, you're going to pick up on those problems and those risks and get them resolved and table them to get resolved any. And you're taking a very different approach as opposed to it becoming a bigger problem and a bigger issue. So that's why it's so important to be proactive and doing those rounds, and checking in. You can't do it. Um, it takes time and effort to go around and check everything, and checking up high, checking down low, and making sure there's no gaps into those barriers that's impacting the airflow and that negative pressure that you need to be maintaining. You're monitoring those traffic patterns, and seeing if anybody is trying to take any shortcuts, and taking paths within the healthcare setting that they're not supposed to, and putting vulnerable residents as well as the staff at risk. So, um, you know, and then you're going to have those going to be those times, um, where it's going to be more higher risk opportunities or moments, I should say. When there's more significant demolition, when there's access required to ceilings and stuff like that, and when there's this important one, when there's when there are tie-ins to existing systems. So whether tying into existing airflow systems, the HVAC system, tie-ins to the plumbing system, so that's impacting the water. These are times like that would be considered high risk moments that you got to make sure that everything is nothing's inappropriate is happening from an infection control perspective. So, but those things that you want to be monitoring. These are high risk opportunities where things can go wrong, and you need to be monitoring those and checking on things a little bit more attention to at those times because of the higher risk associated with them. Right. Another one that also comes to mind is documentation. It's great with everybody having the smartphones and stuff, so we can. It really does show that that you can take those pictures, and it can explain a lot, as opposed to just a phone call or an email or even at a meeting. You trying to explain it. It's easier to explain the problem and support it with documentation and photos. It's very key to be taking those pictures, and then you can clearly show those at construction meetings with the site supervisor. So you can emphasize the importance of taking those pictures so that when you're doing your walkthroughs and when you see problems, that you can be showing people these things need to get resolved, and you've got the images, the photos to support that. So very important. The risk assessments, including the infection control risk assessment, ICRA, depending on how the scope of the project changes, you might need to update the ICRA and do your risk assessment to see if it changes anything, and whether it changes the IPAC measures that need to be put in place for within that matrix that I've talked about earlier. So the matrix between the type of work that's being done and the population of residents, the type of population of residents at risk. So you're going to be doing those, updating those risk assessments, and any of your other documentation that you're doing for your construction project. So you're going to be sending out emails. We can talk about those meetings, construction meetings you're going to, and everything. So there's certainly a documentation piece to it that that you need to maintain and keep it organized, so that you can easily refer back to it when you want. And you might want to upload those the pictures as well with any of the issues, so that you've got that everything in one place to support any of your documentation or to go with any of the minutes, construction minutes and stuff like that. So and then I think for just finish off this segment, is it's important to realize that IPAC is not just showing up when there's a complaint. So I guess there's and the risk has already been introduced, right? That's not if that can occur, risk can when there's a complaint, and you would follow up in the appropriate way, but it's very much and that's a reactive to a complaint. But the bigger piece is that proactive piece that I talked about a bit earlier, where you are going around with your walkthroughs within the construction site and identifying potential problems. Right, you want to pick up on as many of those potential problems as you can before they become bigger issues and results in a complaint coming forward. You don't want to get things to evolve to a point. You want to be, as I mentioned, very proactive in dealing with these issues. So In the next segment, I want to talk about just for uh, a few minutes, those what can occur in terms of communication failures and how to fix them. So, uh, there's many things from an IPAC perspective related to constructions where it is the result of communication failures. Can't emphasize that enough. So, you want to create a situation where you don't have those communication failures. But what can happen is to create those communication issues or failures is that your IPAC is not being invited to the daily huddles related to the construction, or they're not being invited to those weekly construction meetings that I've been referring to. Those meetings are occurring without IPAC being in there. That's a breakdown in the communication related to that construction project, and they need to get resolved as soon as possible. So, um, and then there's another one that um, area that can result in a communication failure associated with a construction project for a healthcare setting is the language barrier in terms of the clinical terminology versus construction terminology. So you got to get on the same speaking a similar language when it comes to everybody's got their various terminology they're using. So you got to figure out those language barriers between the terminology that's often used by those that are working in construction and those who are part of the clinical staff working within the healthcare setting. So that needs to get figured out, and as soon as you get those things figured out and resolved, uh, the better the project will evolve. So the more time and effort you put into it, the better things will be for the construction project. If you don't address them at all, it's going to escalate into a bigger problem within that project, and then you're going to be dealing with a bigger issue to try to fix, and it's going to result in many problems and failures, though, that result in putting the vulnerable residents, if it's long-term care setting or acute care hospital, putting the patients at risk. So, and we don't want that. So we got to get under, resolving those language barriers that I'm referring to here. Um, so some of the things that you can do to resolve or fix, or so those communication barriers don't happen, is make sure that I think I mentioned earlier in this episode, is to make sure those IPAC agenda items are there and that you're adding to it. So every construction meeting, there's going to be so many things that you're going to have there that um, that you're going to be tabling for every construction meeting, and then some of those items might drop off, but then you're going to be adding additional agenda items for IPAC. So you got to make sure that you're there with standing agenda items, and then you're updating them accordingly, taking things off when they get resolved, and they don't need to be put on there on the agenda items, and adding to it at the appropriate time with additional items. So you gotta make sure that you're keeping well informed and well up in terms of what things you're going to be tabling. So, and then um, you got to find different ways, like the things you would do in it for any meetings and stuff. Follow up. There might be some action items for IPAC where you need to kind of just give example. You might need to create like a one-page summary for trades on something that like it could be disposal of construction debris within the healthcare setting. So you got to make sure that you create those materials that they need to provide them with the education. So you're going to be doing those type of activities as well, with the documentation and creating, um, you know, um, those type of materials. I'm just giving them one example with the removal of debris, and make sure it's appropriately covered, and that there's no dust being created when it's being moved within the healthcare setting, and make sure that, you're limiting as much as possible access to our crossing over, or I guess, or going through any patient-related area. So there gotta be a designated path that's set up at the shortest distance, and with one that creates the less vulnerability for the patient. Uh, so, and then another thing for moving on to the next segment is you know, you gotta ensure that for the communications that you understand how to escalate things. It's like, what is the pathway going to be when something happens that needs to get resolved? You know exactly how to what pathway to take. For example, when barriers are breached, so the protective barriers within for the construction project. So you got to know how to escalate those issues so they get resolved. So you got to make sure you get that figured out. So in the almost get close to finishing up. In the next segment, it's important. What is some of the things that healthcare leadership needs to understand. So, um, there's there your role is uh, to keep them well informed. The healthcare leadership within the setting. Uh, and we've already talked about the infection risk being introduced. Uh, um, and you got to be taking that in consideration in the design process very early. So I've talked about that already in the other parts of this IPAC and construction series. But there's many things that impact and why the leadership team needs to be kept well informed, including, the could be an administrator or a CEO or executive director for healthcare settings. So, some of those retrospective, I guess, fixes can cost more. So there's a financial impact that needs to be understood. Potentially reputational impact. So if things are not being taken seriously, and the residents or the patients are being put at risk, or there's a reputational risk there for the healthcare organization. So these are all times where that the leadership team needs to be kept informed. So part of your process and at other meetings is you providing as an infection control practitioner for the construction project is keeping the leadership team informed of what's happening and any issues that might arise. So you got to be keeping them informed as well as anything that's could impact the clinical activities within the healthcare setting. Um, so there's many places where you need to be keeping the leadership team informed, right? Um, so one of the things is, as I mentioned, so you're not a IPAC um, staff, will help protect those project timelines, right? You're not going to unnecessarily create delays, but you're going to make sure that those issues are being taken care of quickly. So that the project, there's many reasons we want to keep the project on time because when there are delays, there's a financial cost associated with that. And construction projects within healthcare are already brutally expensive. So we don't want to be adding to that cost by delaying the projects. You just got to make sure that when you identify those issues, that they're being taken care of. And then they won't result in any delays, right? And you got to make sure for IPAC involvement that you want to be reducing those last minute redesigns. So, if something comes up, you can, I've already talked about it in parts 1 and 2, but the more time and effort that you put into the design phase, and that's why it's so important for IPAC to be at the table before the first set of drawings are created, is to put all that time and effort into the design, so that problems don't occur later on. That's going to be much more difficult to fix, and much more expensive to fix, and will result in delays in completing that construction project. So, uh, you know, we want to you can reduce those issues later down the road by putting that time and effort in from the start, from being very proactive with your involvement for IPAC. And I'm not saying you're going to get everything perfect, because that's not going to happen. But I think you will, by the more time effort you put in it, the better it will be. So that's so important. Um, and that will, you know, as well as the level of involvement that you put in, will prevent any operational delays, um, post occupancy as well. So so important to have the IPAC involved, so that there's no operational delays in getting set up once you do have occupation, uh, post occupancy. So we got everything in place, but so you got to make sure you don't get those operational delays where you can't use that new construction area because of problems related to IPAC, for example. So IPAC involvement will reduce the likelihood of any of those operational delays occurring. So just want to kind of wrap up. It's a fairly long section, so I don't want to go on too much longer. So I think I think in part 4, what I'd like to do, record one more series. So I'm going to try to walk through some more real world scenarios, and what to do when barriers fail, what when timelines shift, and when risk shows up unexpectedly. So I think one more episode, I will feel comfortable. That'll be a 4-part episode, 4 parts to the series, so 4 podcasts. And then I think I will be happy with the issues that I covered. I'm not saying and say there won't be still some things I haven't covered, because I've mentioned construction. There's a lot of things uh, that need to be talked about. So, but hopefully across the 4 podcast episodes for the series, that I've had a chance to kind of talk about most of them. That's what I hope I had gotten to that point. So, I want to thank you very much for listening to this episode. The podcast is part 3. Please share this podcast within your social networks, and do a repost as well within LinkedIn when I do the announcements and stuff, and create and send the link. So usually what I do is I put one link in the LinkedIn post, which is the link for Spotify, and I will bring up an image of the episode. And then in the comments, I will put the links for accessing the platforms like Amazon Music, Apple Podcasts, and YouTube. So in total, I guess it's 4 platforms. So thank you very much for joining today. My name is Wayne Tucker. I'm the host for the Infection Control Change podcast, and I really appreciate you joining today. Thank you.